on Facebook, and please accept that you know that. And I also start our recording. And I'm going to Ukrainian language to speak with our participants into Ukrainian, but we are ready to start. So let's start in 1 minute. Отже, вітання, друзі, дякую за те, що ви до нас долучилися. Ми маємо сьогодні трошки учасників в Zoom, ми маємо глядачів на Фейсбук-сторінці Світові. Це, в принципі, означає, що ми матимемо збережені 2 формати нашої зустрічі. Одна з них буде на Фейсбуці, одна з них буде потім викладена на YouTube-канал Світові. Я знаю, що потроху долучаються учасники, пані Ганна, Ірина, Олександр, Олена, Світлана. Дуже важливий момент. Будь ласка, по-перше, напишіть, чи ви мене чуєте. А по-друге, в нижньому кутку вашого комп'ютера або в 3 крапочках вашого мобільного телефону вам треба натиснути на глобус і обрати, якою мовою ви сьогодні хочете прослуховувати подію. За позначкою IN, English, буде оригінал англійською мовою від наших експертів, яких ми сьогодні маємо в гостях. Ви бачите, що нас сьогодні багато. А за позначкою D, німецькою мовою, буде україномовний переклад. Тому, якщо ви хочете чути наших експертів в перекладі Анни та Олександри, наших неймовірних перекладачів, будь ласка, оберіть позначку німецької мови. На жаль, ми досі не маємо німецьку мову серед запропонованих, тому українську мову, вибачте. Тому маємо або опцію англійської мови за позначкою English, або опцію українською мовою за позначкою D, Deutsch. Сподіваюся, ви розібралися з перекладом. Якщо ви маєте з цим проблеми, напишіть в чат, і я вам допоможу. Ось, а в цілому ми з вами розпочинаємо подію, і я хочу передати слово Зої Литвин, засновниці громадської спілки Світові.
Can we have the first slide, Elizabeth, please? Good morning. Welcome to our webinar today. We are very appreciative of the invitation to share with you methods that we use to increase resilience in children that experience trauma. There's a need to develop antidotes for when we get poisoned. And in the same way, when insults happen, when we are bombarded by traumatic stress, and when our children are exposed continuously to not only 1, 2, but daily traumas, it is important to find antidotes for them. Today, we're going to talk about what we consider some of those antidotes. You'll hear about mindfulness, for example, but you will also hear about things that children already do, like play. Play is critical, is very important, not only for young children, but for all children and for adults. Unfortunately, trauma can also take over play, and we will be talking about this as well. My name is Victor Carrion, and I'm professor at Stanford with a specialty in child psychiatry. Today, we're going to, after this introduction, we're going to be introduced to the concept of mindfulness, and we're going to do an exercise. We're going to do this throughout the talk. Then I will talk to you a little bit more about the role of stress during development. A colleague of mine then will present the method that we use to treat children that experience trauma. This is the Q-Center therapy protocol. We will have another colleague talk about her lived experience as a child, experiencing trauma in Bosnia. And then at the end, we'll try to put all this information together. It's very important for me. And then after all that, we'll have a Q&A. But it is very important for me and for the rest of the panel that certain concepts are addressed during the day-to-day. So next slide, please. One of the things that we're going to talk about is the difference between stress and traumatic stress. I will introduce an inverted U-shaped curve to describe this. And also we'll talk about the metaphor that we use for accumulated trauma, which is a backpack. We will talk about self-care. How can we take care of ourselves so that we can be ready and be able to help others in areas such as sleep, nutrition, the way that we think, mindfulness, as I said, avoiding drugs and alcohol, and just seeking help and talking about our experiences. Next slide. We all want to know what to do. And this is the PIT, right? This is the PPIT. We want to protect, we want to prevent, we want to identify, and we want to treat. We want to protect children, and it's okay to seek help, and we need to teach them that it's okay to seek help, that it's important to talk, that it's important to tell their stories. And we need to also identify who is the right person or the right people or the right village that's going to be taking care of this child. We will talk about prevention, how we develop what we call a toolbox, so that the kid has not only one tool, but a number of tools that they can use, like exercise, yoga, mindfulness, play. We will identify when a child, we will need to know how to identify when a child has been impacted by trauma. Things like academic decline, having more fights, more arguments, we need to keep in mind. Is it different than at baseline, and is it developmentally appropriate or not? And then we need to treat. And this is where my colleague, Dr. Kletter, will be talking to all of us about cue-center therapy, the approach that we use. Not that we expect all of you to become therapists in the next hour, but what we want is for you to A, know that this treatment protocol is available, and B, see if there's anything in it that is helpful for your interaction with children. Next slide. Once we start this talking, we need to know what is important to say, right? And the first thing that I will say right away, because I don't want to forget about this, is that children need to know that we are here to protect them, that we are here to provide them with safety. We are here to balance, to be the antidote, right, to those negative experiences. They need to understand the difference between good and evil and everything in between, and also between grief and hope. And how when we're doing things now for us, we're not only doing it for ourselves, but we're doing it for our community, we're doing it for our neighborhood, we're doing it for our country, right? So there's a big lesson of citizenship here that children can learn as well. But of all these messages, the message that we are here to provide them with security and safety is probably the most important one. We need to understand symptoms. We need to see how time is important in the development of symptoms. Sometimes symptoms do not develop right away. Sometimes it takes months. Sometimes it can take years when some of these cues that you're going to hear about prompt the development of these symptoms. We'll talk about things, for example, like hypervigilance, and I will come back to this later, but that's like this hyper alertness that sometimes when living in a situation like our children are living nowadays, it is important to have. So it's not necessarily only a symptom, but sometimes it's a protective mechanism. The ability, what we need to learn how to do is when to turn it on and when to turn it off, right? When there is a need for hypervigilance and when there is not. We will see sadness for the losses that are incurred. And like I referred to at the beginning, trauma can take over play. And we will recognize traumatic play from regular play when we see that the play is not enjoyable and is perseverant. It keeps repeating over and over again the same scenes about fights, for example, with no joy in the face of the child when playing this game. And then we'll talk about moving forward, history as a lesson, identity formation, how to build strength, how to build empathy. All of this means how to build resilience and how to really become adaptive. And the twin peaks of life, right? This is what I'm talking about, where the stress is there, the traumatic stress is there, but the antidotes, the play, the enjoyment of life celebrations, for example, also needs to be there. So next slide, please. So without saying much more, we will introduce you right away to the concept of mindfulness. And for this, our colleague from Madrid, Susana Cruelas, a child therapist, will introduce us to this concept. And I'll be right back after that.
Thank you very much, Dr. Carrion. Hello, everyone. Happy to be here with all of you. So we are going to start just talking about mindfulness. I don't know if you are familiar with that, but we're going to do 3 mindfulness practices during this webinar. Don't worry if you don't know how to practice mindfulness, because I'm going to guide you through the exercise, through all the exercises. And the exercises we're gonna practice, you can find them in the PureEdge website, and you can practice yourself and you can practice them with your students. So they are totally focused for children and they are very easy to do. Some of them are easier, some of them are more difficult and more advanced, and you can find them on the PureEdge website. So what is mindfulness? Mindfulness, as it says here, according to John Kabat-Zinn, is awareness that arises through paying attention on purpose in the present moment, non-judgmentally. It is being aware of what is happening as it is happening, with kindness, love, and compassion. Why we believe it's important to practice mindfulness? As Dr. Carrion said, because we work for others and we have to first work on our self-care to be able to care for others. It's something that we really, we believe in this and we practice it and we do it. So we all take care of others professionally and in our personal life. So it is important to work on our self-care to be able to care for others. The other reason why it's important, we believe it's important to practice mindfulness, is because while practicing mindfulness, we are calming down the autonomic nervous system. When we are under stress and ongoing stress, our amygdala, we'll talk about it later in some of the slides, activates releasing a lot of hormones, including cortisol, the stress hormone. And we can calm it down. We can calm down the amygdala. It's the one responsible for our fight or flight response. It doesn't mean that the amygdala is not going to work when we don't need it. It means that we can calm it down, turn it on and off, as Dr. Carrion said. And we can hack our nervous system when we don't need it to be active. Another thing to note is that while doing these practices, you have like strong feelings or emotions, it could happen, or unpleasant images coming to your mind, very strong or overwhelming sensations. You could back off the practice, and I recommend you to utilize the 5 senses to reground yourself in the present moment. You can go to what you're hearing, what you're seeing, smelling, touching, to reground yourself in the present moment, or you can even put your hand on your heart and believe you feel like there are overwhelming sensations and emotions. So next slide, please. So this practice is one of my favorite practices of PureEdge curriculum, and it's called the starfish breathing. First, I would like you to sit in a comfortable posture. You can stand up if you want, but you can, whatever posture you feel comfortable, standing up or sitting down. And we're going to use our hands. So imagine, I don't know if you can see me, but imagine that our hand is like a starfish. So open up your fingers, and with the index finger of the other hand, we're gonna move it along the contour of the starfish hand. I'm gonna do an example. So when we breathe in, move the finger up, and when we breathe out, move the finger down. So we're gonna start from the thumb. So breathing in, possible through the nose, breathing out, if possible through the nose, breathing in, breathing out, breathing in, breathing out, breathing in, out, up, down, and then we go back, breathing in, breathing out, breathing in, breathe out, breathe in, breathe out, breathe in, breathe out, breathing in, and breathing out. What I love of this exercise is that it's very easy, takes like around a minute. I can see some hearts going on there, thank you. Beautiful hearts and smiles. And you have several senses involved here. You have the touch, the movement, the breathing, the eyes that move. So several senses involved, and you can practice them with children. It's really fun and easy. You can teach it to your students. So now I'm going to leave you with, I pass it along to Dr. Karen again. Thank you very much.
Thank you, Susanna. Susanna introduced a group called Pure Edge. We collaborate with Pure Edge to offer interventions that are complete. So that it's not only treatment, but it's also prevention. And these yoga and mindfulness exercises are part of that prevention. In one of our slides, you will find the link to Pure Edge. And we thank Pure Edge also for making the connection between our program and all of you, the organizers of this webinar. As you can see, the exercise is for you to use, but it's also for you to teach. So everything that we're going to talk about is about self-care, but also how do we teach that to others. And it's really age-free. This could be for adults, for adolescents, for school-age children, for preschoolers, presented in a developmentally appropriate way. Okay, let's talk about stress a little bit. Next slide, please. Hopefully, after our talk, you'll understand the impact of stress, how we can strengthen kids' coping skills and provide them with stronger supportive systems, and how can we harness our brain adaptability to build resilience. Resilience is not all or none. Resilience can be compartmentalized and can change from time to time. And resilience is like a muscle that we actually have to exercise and build. So we'll talk about some techniques on how to do that. Next slide, please. So what we see with stress is that it operates like a mountain, right? It goes up and it goes down. And what that means is that at the beginning, if we have no stress at all, our performance, our happiness, our health probably would not be that great. We need some degree of stress to really develop our system. And this is helpful stress. It's called eustress. But this is true only to an optimal point at the top of that mountain. After the top of that mountain, we start getting into more stress, right? Higher stress. And then that starts affecting our health. And that's what we call traumatic stress. Next slide, please. Children have definitely been stressed. In 2021, more than 70 million children were exposed to the pandemic with all of the problems associated with that, interruption of their education, separation from family, loss of support systems, They were exposed to natural disasters, wildfires, flood, storms, that brought loss of property, loss of life. Of course, war has created everything the pandemic has created and everything the natural disaster has created, and has brought also violence with racial injustice and political divides. Next slide, please. And this is the reason why you're concerned. And this is the reason why you're here. You want to know how to help the kids that are exposed to all of this. We need to recognize the alarm when trauma strikes, and that can be different for different age groups. And I'll give you some examples. Here on the part that's in bold, we can see the different ages. On the opposite column, we can see symptoms that can affect any age group. But what we see in preschoolers is that when they get traumatic stress and they get symptoms from traumatic stress, they may get more clingy, or they may regress in their behaviors. So they may start sucking their thumb again, even when they had stopped doing that. They may wet the bed, even when they were not doing that anymore, and behave in such a manner. With school-age kids, what we see is that they can somatize more. So you can see stomach aches, you can see headaches, and then in adolescence, what we see is more withdrawal. And it is important to recognize these reactions and to address them. And of course, at any age, we can see all of them. So these are just some rules of thumb, but we can see excessive sadness, unhealthy eating, acting out, difficulty with attention and concentration. And like I said at the beginning, if this is not something that was there before, it's probably related to the amount of traumatic stress that they've experienced. Of course, the stress now has been so chronic that it's hard to know what's baseline. So they might have been experiencing symptoms like this now for a long time. What you want to see, the rule of thumb, if you don't know when it started and you don't know, the rule of thumb is to see the impact that these issues are having in their life. Is it affecting their function? For example, do they come to class feeling more tired? Do they come to class feeling more hungry? So if it affects their function, then it's a problem that we want to target. Next slide. Next slide, please. So something that happens during stress biologically is that we all release a hormone called cortisol. And on a daily basis, next slide, please. On a daily basis, we all, from this axis that begins in the hypothalamus, release this hormone called cortisol that helps us address daily stressors, right? So we eat breakfast, cortisol goes up so that we can manage digestion. If we're going to cross the street and a truck is coming, cortisol goes up, and the sympathetic system, the adrenaline, also go up so that we can jump out of that situation. Now, what happens when you're 5, 6, 7 years old and you feel like a truck is coming at you every day for more hours than not? Well, that axis that I'm showing here and that sympathetic system become desensitized to some extent. And what we see is that at the beginning, there's a high release of cortisol, and you see high levels of cortisol. But when a problem becomes very chronic, then you start not releasing cortisol when you need it. You don't need to know what the cortisol is in a child, other than I'm just sharing this to say that there's a biological issue that is happening concurrently when you're observing those behavioral problems. And this cortisol actually can have an impact on physical health, and which is why you see that sometimes after stress, people also get not only mental health condition disorders, but also physical illness. Next slide, please. It's all a balance. It's all a balance between our stressors and our resources. So in this example here, we have stressors of isolation, of health risk, of vicarious stress by seeing others struggle and seeing others suffer, and also home and family stress. And what are our resources? Our coping skills, our self-care practice, like Susanna just took us through, our school relationships, our structure, our social support. Next slide, please. But what happens when that balance is not there and some of the resources are not there, right? What happens when our school closes, or what happens when our teacher moves away or gets killed even? Then the weight, as you can see, shifts towards the other side. And then what we need to do is replenish those resources with what was there before, or with anything else that could recreate that balance again. Next slide, please. So what do we do? What do we do to strengthen those support systems and have that on the side of the balance that's helpful? Well, we have to work with ourselves, right? Families, educators have to get involved in self-care so that they can model to the children how important it is. How important it is not to use drugs and alcohol, how important it is to sleep well, how important it is to have good nutrition, how important it is to do exercise like mindfulness so that we can bring oxygen into our system, and that oxygen can go to the muscle and help relax it. It is hard for children to go to the column of stressors and start getting rid of those, right? So what we need to do is help them fortify their support side. But not only the kids is what this slide is saying, but also their support system, ourselves as educators and ourselves as a family. We need to increase their coping tools. We need to think of this toolbox that you're going to hear about during Q-Center therapy to really have more things available to them, that if they cannot use some because they are, let's say, in a classroom, they have other things available to them. Coping tools such as safety, knowing what to do to be safer, giving them information that is true without being alarmist, having good communication and offering protection. And we also need healthy strategies like Q-Center therapy and like the mindfulness curriculum from which we draw from Pure Edge, these exercises that we're talking about today. Next slide. So you will hear about Q-Center therapy. We use this idea of the backpack. This is why I have the slide here, just to demonstrate the heaviness of a problem. And what that means is that in many ways, in the same way that we regulate temperature, for example, through the process of homeostasis, we can regulate the amount of stress that we carry. We can carry heavy loads, right? But if you're 5, 6, 7, and your back is really heavy, you may fall backwards. And that is an example of when that backpack gets too heavy, when the allostatic load, we call it, or when the chronic trauma or the traumatic stress has accumulated to such an extent that even if you have a few coping tools, it's not enough. At that point, we really need to help the child unload some of that exists in the backpack. Next slide, please. And how do you do that? You do that with this CCT training course, and it now is online, and Dr. Kletter will talk more about this, and I'll let her talk more about that. Okay, next slide, please. So how do we do it? How do we talk to kids about all of this that we're talking about? How do we begin the conversation? Well, it's very important that we are direct. As you know, children are very concrete. They know if you are beating around the bush, they want to go to the point. So it is important to be clear, to be direct, and to be succinct. Sometimes kids will be open to this and will want to talk. Other times they won't want to talk, but that doesn't mean that they will not want to talk tomorrow. So an important message that you want to give is that the conversation is open, that they can actually come and have the conversation whenever they feel ready and prepared for that. Children need to know that it is our job to keep them safe and secure, and that we feel competent and confident in doing so. They really need to hear that. While kids are at home, it's important to limit their TV coverage related to the crisis. It is important to stay informed, right? That's why you're clear, direct, and succinct, but they don't need to follow everything that's happening in every single corner if that's really not going to be of help to them. And like I said, it's important to continue to encourage play. Play is very important. It's not only for fun and it's not only for enjoyment, but it's how kids develop socially, is how kids develop physically, is how they develop in terms of engaging with others and socializing and all of that. And because of circumstances, play may be more limited, it is important to be more creative. And you can actually invite them to be part of that creativity, okay? Flashlight tag, for example, during the pandemic was something that kids were doing because they couldn't touch each other at that time. That's an example of being creative. Next slide. We also have a program on our website, and we'll share this. Well, the website is right here with you. We'll share our website, but these are two sites for this thing called Bridge to Learning that we do. It's a program for coaching and help teachers in their professional development on mental health related issues such as the neuroscience that we talked about today, issues like mindfulness, issues like motivation, how to engage children, everything related to social emotional learning. So you can find more information about Bridge to Learning on our website, which we will also share with you. Next slide. And okay, next slide. I go over that one. Okay, everything once again in order to regain that balance between stressors and resources. Next slide, please. Now, having heard all of this, how do we then start building resilience? And how do we build resilience into how our brain functions? Because we want that resilience to be there for the next time that we use it. And notice that in this picture, there are areas such as the amygdala, the emotional core of the brain, and the hippocampus where we process memories. These are two structures that are very sensitive to the effect of cortisol. So at that early stage of stress, when cortisol is elevated, we have demonstrated that it actually can alter the structure and the function of these key regions. But also something else I want you to look at is what else is in this picture. And those are the senses. We have the nose, we have the mouth, we have the eye, we have the skin. And those are our senses. Those are our windows into our central nervous system. So those cues, those triggers of what we see, what we smell, what we feel, what we hear are critical in terms of how we develop symptoms and how we can fight those symptoms. So part of that, once again, you're going to hear from Dr. Kletter in terms of how to use those cues for our advantage in helping the kids build this adaptability and this resilience. Next slide. One thing that's important is that these areas that I'm talking about, areas that in the limbic system, like the amygdala and the hippocampus, and also cortical areas, what we use to do our thinking and how we change negative thinking to positive thinking, which is important to do. These are highly complex areas of the brain, but as you can see in this figure here of an inverted triangle, the more complex they are, also the more plastic they are. And we want to take advantage of that neuroplasticity that exists in our brain, because basically what neuroplasticity means is that we have a window of opportunity to help children and adults to really make this brain structure and brain function work in a way that works for the child. And that's really what resilience and adaptability are. Resilience means that we return back to our function, right? So we go back to how we were functioning. Earlier, I talked about the importance of looking to see if something alters function or not. Adaptability, I think, is even more important than resilience, because it means not only you bounce back to where you were, but you bounce back to a better place. So after the pandemic, for example, we don't want to necessarily go back to where we were. We want to go back to a place where we have better knowledge and better understanding, right? After the war, we don't necessarily want to go back to where we were. We want to be in a better place where we are more protected and better equipped to fight any future insult. So adaptability is also something that we need to target. So I'm talking about brain circuitry. I'm talking about brain networks. And I want to tell you that a lot of the things that we're talking about today, the reason we believe in them strongly and we present them in webinars such as this is because we have done research that demonstrates that they actually can improve how the brain functions. We've seen what cortisol does to the brain through stress, but we've also seen how some of these interventions that we're sharing with you do the opposite. They actually protect the brain and they can repair some of the damage that might have occurred by stress. So not only we have done clinical trials and demonstrated that they are effective and they decrease symptoms, there's also a neuroscience validity to these interventions that we're talking about, especially when it comes to things like emotion regulation, how we regulate our feelings, and also executive function, how we organize and plan and organize, all characteristics of the prefrontal cortex of the brain. So for example, we've seen with cue-center therapy that there's increased activation of the prefrontal cortex. And with yoga and mindfulness, we see that we can actually decrease that hypervigilance that we can see in the amygdala at times. Next slide, please. All of this to say that self-regulation is also very important, but it's also related to our central nervous system. The vagus nerve, that which attaches to many organs in the body, including our brain and our heart, really help connect both of them. So we can have a physiological response to what we're thinking, but also the physiology in our body can alter how we think. It goes both ways. So we do exercise, we do yoga, we walk, we do whatever we can do, and that can help those networks that we were talking about. But also, if we engage those networks, we can also feel better in the body. That's why as children get older, sometimes they somatize. It's not like they're necessarily making up the stomach ache or the headache. It's that they're very sensitive to changes that may be happening in their body. And this is how they express them. Next slide. So there's a lot that we don't know about resilience, but there is a lot of important things that we know about it. The most common finding in the literature in terms of resilience is that children that are resilient have had the presence of an adult that has created a significant impact in their life. They were there to listen. They were there to talk. They were there to do a lot of the things that you know and that you've been doing, but also a lot of the things that we've been talking about. And this is, like I mentioned, a muscle that we develop. We still don't know, though, if there is something intrinsic in the child that makes them seek that type of relationship with an adult. right? So there might be something more biologically, and we're doing some genetic studies to see if what are the components of genetics in resilience. But things like that good attachment, emotional regulation, which we mentioned, creativity, which we mentioned, are important. And the term that I really like is this cognitive flexibility, the ability to think of things in more than one way, and the ability to know when to turn on and when to turn off that hypervigilance, and the ability to take a negative thought and change it into a positive thought, or not necessarily get rid of it because that negative thought may be real, but have some positive thoughts that help balance that out. All of that works at a neuroscience level, like I've been describing, and it also works behaviorally. This is a dynamic process. It needs practice, and it is important to practice. It is important that the more we practice positive thoughts, for example, the more positive of a thinker we become. So it is very important that we practice some of these exercises on a daily basis. Next slide. And here's practice. So executive function, the importance of positive thoughts, we talked about that. Emotion regulation, the importance of mindfulness, because we know that mindfulness now can decrease that activity in that amygdala. We heard about breathing. Breathing is what keeps us alive, right? We know we're alive because we breathe. So if we breathe better, we live better. So it's important to breathe deeply and be conscientious of the process of breathing, because even though we're breathing all the time, we may be breathing in very shallow ways, and we really need to make the best out of it. You heard Susanna mention the exercise of 5 sight, 4 sound, 3 things that you touch, 2 things you can taste, 1 thing you can smell. When you think about these things, it brings you to the right moment. So look around you. Tell to yourself 5 things you can see. Let's be quiet for a second and see if you can hear 4 things. In your touch, see if you can feel 3 things. Do you have 2 tastes in your mouth? And do you smell 1 thing? So, you know, it kind of brings you, seats you to the moment. And of course, when you do it, you can take more time. I'm just going through it very fast right now. Next slide, please. So we call these brain breaks. Here's Pure Edge address. It's just pureedgeinc.org. Easy to go. They offer a number of important brain breaks of this type of exercises that we've been doing, and they have also translated into Ukrainian some of these programs. So you will have those available to you as well. Next slide. Okay, and now I'm going to pass it on to Dr. Kletter, that will be talking in more detail about the treatment that we use that I've been alluding to, Q-center therapy.
Thank you, Victor. Hello, everyone. My name is Dr. Hilly Kletter, and I'm the director of our Stress and Resilience Clinic at Stanford University. I'm a child psychologist. I also direct our Q-centered therapy training program. And today I will be speaking to you about what this treatment includes and why we developed it. Next slide, please. So Dr. Carrion already talked to you about the impact of stress, but more than 1 in 4 children, regardless of their economic status, will experience a significant traumatic event before reaching age 16. And the general prevalence amongst youth who are not traumatized tends to be about 4 to 6%. When we're talking about situations of interpersonal violence, like the conflict that's been happening in the Ukraine, the numbers increase significantly. right? Where you can see within our own studies of youth with interpersonal violence, we're talking almost about 60% meeting criteria for diagnosis of post-traumatic stress, and another 43% almost having subthreshold symptoms. Next slide. When we're thinking about trauma, it's important to note that there are two kinds. Type 1 is a single event, something that happened, let's say a car accident, it happened, it's in the past. However, the majority of cases that occur are considered type 2, where it's multiple events or they're ongoing, they're chronic. And with the conflict in the Ukraine, we're really talking about type 2 trauma, where not only is there the direct exposure, right, to the war and terror, but there's also secondary traumas, which may include things like loss and grief, displacement, disruption of daily living activities. And when you have this piling up of stress, it can start impacting many different domains of functioning. So it can impact attachment and social functioning. It can impact the ability to learn or take in new information. And that's why we see that a lot of kids that have been exposed to trauma have difficulty, right, in the classroom, difficulty paying attention or concentrating, difficulty retaining information that they already know, or difficulty learning new information. So this is the type of trauma that we're addressing with cue-centered therapy, and that's really what led us to develop this treatment. Next slide. So cue-centered therapy came out of the idea that we know that there's a lot of different treatments that exist for kids experiencing trauma. However, when we're talking about this type 2 trauma, otherwise known as complex trauma, right, where there's a piling up of stress that's ongoing, we really need to shift our thinking rather than just looking at the traumas in isolation, to look at something called the allostatic load. This is the accumulation of stress across the lifespan. So Dr. Karian talked about the effects of stress on our physiology, right? What's happening in the HPA axis. The allostatic load is what's happening as these kids are going through not only being exposed to the actual experiences of the war and terror, right, but all of the aftermath that comes along with it. And where are they on that load? CCT really focuses on providing them with insight and education on understanding that process, understanding how their traumatic experiences are impacting them. And then we'll also talk about cues. These are reminders, things that are neutral stimuli in the environment that through learning become associated with the traumatic experiences and can cause similar reactions. Next slide, please. So cue-centered therapy combines many different approaches, right? It combines narrative therapy, which is talking about, Victor talked about the importance of creating a story, right? Expressing what happened. And we definitely do that within this therapy. It combines family approaches. So we try as much as possible to work and involve the caregivers and strengthen the relationship and help the child identify what are other sources of support. Remember that one of the key ingredients for resilience is just having one consistent individual in the child's life, right? And it's 15 sessions long with the flexibility to add additional sessions as needed to teach these concepts to the kids and their families. We focus on the child, really trying to empower them to be their own agents of change, but we also work with the caregivers to teach them the skills and reinforce the practice. The treatment has been standardized for kids ages 8 and above, but we've adapted it for kids as young as 4. There are a lot of visuals that we use to teach the concepts, or we can add play or art and adapt it in that way to work with younger children. And the focus is specifically on those situations of type 2 trauma, right? That chronic ongoing trauma when that allostatic load is increasing. And we've used it with many different kinds of traumas, including individuals that have been exposed to war or terror situations. Next slide. The aims of this therapy is to help kids identify their thoughts related to the experiences and to develop that cognitive flexibility that Dr. Karian was talking about, right? We're not necessarily trying to get rid of the thoughts or change them, because a lot of times there is some truth and they're protective. There's a reason that they developed, right? They were adaptive. We're helping the youth understand when are times that it's helpful to be thinking in that manner, when are times that it might get in the way, and that it's kind of a false alarm. We're also helping them identify their feelings related to the experiences and learning how to regulate those feelings using some of the techniques that Susanna and Dr. Karian have already demonstrated and talked about. We're helping them identify what are the responses that developed out of the traumatic experiences and learning to gain control over them. And we do this by providing them with education, understanding what trauma is and what it does, and by helping them develop coping skills so that they themselves then can affect the change. And then finally, as much as possible, we're working on strengthening the relationship between the caregivers and the children, right? Enhancing that social support piece, that protective factor. Next slide. So the square is a key concept that's repeated throughout cue-centered therapy. And the idea is that we use the square to help children identify what are the reactions that developed out of their traumatic experiences, right? And you can see that there's 4 corners and they're all interlinked, meaning that they can all influence one another. So we help them identify what are the trauma-related thoughts, what are the emotions, right? The feelings, what's happening in their body. Victor talked a lot about somaticizing being a common symptom, but we help them identify those signs that tell them in their body when they're feeling anxious or scared, right? Things like their muscles might get tense, their breathing gets shallow, their heart starts beating faster. And the final corner is identifying what they do, right? What are their behaviors or actions? And through teaching them coping skills that address each of these corners, the idea is that we can start with any corner, it doesn't matter which one, change any corner, and the others are also going to automatically change. And this is a really powerful way, right, to help the children gain mastery, to understand why these reactions developed and how they can change them by use of these simple coping skills that we apply. So Dr. Karian talked about the amygdala, right? That section of our brain that's a fire alarm. It's responsible for our emotions, and especially the emotion of fear. And that part of the brain acts as a fire alarm anytime there's a danger. However, with situations of trauma, especially when it's ongoing and chronic, that fire alarm can sometimes get stuck in the on position, that it keeps sending a signal that the child is in danger, even in situations where they're not. An example could be after a bombing, right, which is a real threat, a child might start reacting to any loud noise. That loud noise has now become a cue through learning. It reminds the child of that bombing and maintains the same reactions in that square. Part of the work that we do in cue-centered therapy is helping kids identify what are those cues that developed through that classical conditioning, through that learning process that have become paired with their traumatic experiences? And what are the reactions that have developed as a result of those cues? And then we teach them to practice new responses, right? And by practicing those new responses, they can actually build new squares over time to override that original response. Next slide. So there are 4 parts to cue-centered therapy. And the first part, we teach them a lot, part of what Dr. Carrion talked about a lot. What is stress, right? How does it impact individuals? What are the different reactions that they can have? What's happening in the brain? Because we believe that by providing them with this information, they can understand what we're doing in treatment and why we're doing it, right? We also develop a coping toolbox, and this coping toolbox is some tools that we offer as suggestions, things they might want to try out, such as some of the mindfulness skills that Susanna presented and will be presenting later on. But we also really encourage the kids to think about what are things they're already doing, right? We want to capitalize on their natural coping resources. Kids are very good at being adaptive and resilient. I know before we started this talk, we were talking with some of the individuals hosting, right? And they were telling us how you educators keep on going in spite of everything that's been happening, right? That you show up and you adapt. And that's one of the things that we try to emphasize in cue-centered therapy for how kids can do that by capitalizing on what are the things that they're already doing in their day-to-day to help them get by, right? And it can be things like listening to music, talking with friends, art, dance, right? Anything that's helpful to them, that helps them relax or helps them feel good. And we include that in the coping toolbox as well, because if it's their own idea, they're much more likely to use it. The second phase of treatment is creating that story that Dr. Carrion was talking about, right? Helping them express and talk about and process what happened. And as we're creating that story, we're really trying to connect those corners of the square. Remember how we said that trauma reactions a lot of time can get compartmentalized. So sometimes I might know I'm feeling this way, but I have no idea why, right? So we're trying to connect all those corners to a coherent story. This happened to me, and because of that, I feel this way. And this is what my mind is telling me. And this is what I'm feeling in my body and what I'm doing. And understanding those cues, those reminders that have developed as well. The third phase then is we actually confront the cues, help them practice using their coping skills to develop that new response, right? To change that square. And finally, in phase 4, we kind of bring everything together to make sure that they know how and when to use those coping skills and feel like they have a solid plan for the future of what to do. Next slide. So summarize just a little bit of the research that we've done with cue-centered therapy. Our first study, we had 65 kids, ages 8 to 17. We were in 13 different schools that were high risk. And one group started the treatment right away. One group was waitlisted and started the treatment 3.5 months after, which is the amount of time it takes to complete the treatment. And you can see that these were highly traumatized youth. All of them had at least 2 traumas, but the average number was 5. And these are the types of trauma that the majority of our participants had. So separation and loss was very big, witnessing violence, homicide, physical abuse, and bullying. Next slide. And we measured them at these 4 different time points: before starting the treatment, mid-treatment, after they completed the treatment, and then 3 months after. And what we found is that the group that received the therapy right away had much more significant reductions on symptoms of post-traumatic stress, but also anxiety and depression. And this was both by the parents' report and the child's report. We also saw that the parents themselves had a reduction in their own anxiety, and that there was overall improvement in functioning, as was rated by the therapists. And all of these gains were maintained at that 3-month follow-up. Next slide. So we then did a second study where we now know that CCT is effective. And in this study, we were at a community mental health agency where 90% of the kids, regardless of why they're coming there, are trauma exposed. And this time, we assigned them to one of 3 treatment conditions: Q-centered therapy, TFCBT, which is another very well-known and common treatment for kids with trauma, or treatment as usual, which is the practices that this agency was providing, which could include things like family therapy or case management, art therapy, many different services. And we're looking at these 3 different treatment conditions. And you can see that, again, we're having very high rates of trauma. 93% of our sample had multiple traumas. And you can see many different types, but a lot of interpersonal violence, which is the majority of what we treat and see. So very similar to some of the experiences that some of the youth you're working with may be experiencing in terms of the conflict right now. Next slide. And again, we're measuring them at those 4 time points. And we found that the trauma-focused treatments of both Q-centered therapy and TFCBT are showing better improvement than just treatment as usual. And as Victor already talked about, we also were looking at what's happening in the brain as these kids are completing treatment. And we saw that those kids that are showing improvement in their trauma symptoms are also showing changes in the brain, right? That those areas in the brain that were impacted and that we already know from prior research are impacted by trauma, and that Victor already talked about, are being normalized, meaning that treatment is improving the functioning. And that's the really good news, right? That a lot of times there's this concern of, oh, does this make permanent changes? Does this impact the connections in the brain? And we know that treatment can actually help reverse that, right? And help them develop new connections through practice. Next slide. And now we have a 3rd study underway. This 3rd study is going to look at kids in Puerto Rico who have been impacted by natural disasters in the last few years and the pandemic. And we're going to look at the efficacy of CCT, but also at the genetics. And is treatment having any sort of impact to contribute to resilience on a genetic level? Next slide. So Victor already introduced the training program. For those interested in becoming therapists on Q-centered therapy, there are steps involved to becoming a therapist. There are 3 of them. The first one is an online course that we developed, and this online course is currently up and available, and you're welcome to take it. It provides an overview of Q-centered therapy and some of the key concepts. And we'll have the links for you available in the slides. The second step is really kind of more in-depth practice that's meant for clinicians. And then the 3rd step is actually practicing with cases. Next slide. And we have our therapist manual available in both English and Spanish. And here you have the links to the online courses, both the English and Spanish versions. That will give you more background on the treatment. And I will now turn it back to Susanna.
Thank you very much, Dr. Kletter. So let's practice. It's time to practice now. I think we have been like an hour sitting down. So we're going to do a movement exercise, and we're going to try to change one of the corners of the square. And let's see if the other corners change. So for this movement exercise, if you have any physical condition or any pain or problem, it's no problem. You don't need to do it. Just listen to the guidelines, and you think about it to practice with your students. In any case, I suggest you to do it gently and softly, and doing you graduate your own intensity of the movements. Because I don't want you to get injured or, while doing this exercise. So gently and softly. This exercise is called From Star to Triangle, and is also on the PureEdge website. For this exercise, I would like you to stand up. So please stand up. I cannot really stand up because otherwise I would lose the connection. But please feel free to stand up, just shake your hands, legs. We have been sitting down for an hour, even more than an hour. So, yes, I can see some body movements. Great. So with this standing up, I would like you to go to mountain pose. Mountain pose is, you can see this little frog here that is helping us with the exercise. You stand up like with the back straight and the feet same length up as your hips, parallel to your hips. So we're going to do breathing exercises and combine it with some movement exercise. So breathing in, and while breathing out, open your legs and your arms as this little dragon. Then breathing out, and then breathing in, and while breathing out, we're going to go to the left. Try to reach your foot with your left hand, and your hand trying to touch the sky, and your head moving, looking towards your hand. Breathing out here. Now breathing in again. Now back to star. Breathing in here. Now we're going to go to the right. Breathing out. Right hand towards right foot, and left hand towards the sky. Head looking to the hand. Breathing in here. Back to star. Breathing in here, and back to mountain pose. Good. So 2 more times. We're going to do it 2 more times. So breathing in, star. Breathing out, going to star. Breathing out here. Breathing in towards triangle to the left. And here, breathing in, and while breathing out, star. Breathing in here, now triangle to the right, while breathing out. Breathing in here, and breathing out towards star. Breathing in here, back to mountain pose. And one last time, breathing in. Breathing out, star. Breathing in, triangle to the left. Breathing in here, and while breathing out, star. Breathing in here, and breathing out to triangle to the right. Breathing in here, While breathing out, star. Breathing in here and back to mountain pose. And we have finished this exercise and hope you're changing the rest of the corners of the square. And this exercise you can practice with your students. And it's really fun, and you can do it online as well. So thank you very much, and see you towards the end. I pass it along to Dr. Tanovic. Thank you.
Hello, and my name is Dr. Salma Tanovic. I am originally from Bosnia and Herzegovina, and I am now doing psychiatry residency at Stanford, and I'm soon to become child psychiatry fellow. Next slide, please. In this presentation, I will share my personal experience and view on growing up in wartime. My intention is not to take up space from children who are going through horrible experiences at present moment, but to share what might be helpful with respect to community interventions. However, all people and experiences are different, and what worked for the context I lived in might not apply to other contexts. 30 years ago, first pictures of aggression in Bosnia were broadcasted in media in Western world. Civilian deaths, premeditated destruction of cities and cultural heritage, and horrifying atrocities took place in this small country in the heart of Europe. On 24th of February 2022, Bosnians around the world were watching the news paralyzed, reliving their experience and deeply feeling for people in Kiev, Kharkiv, Mariupol, and other cities across Ukraine. I was 12 years old when the war started, spending formative years in besieged Sarajevo under daily shelling, sniper fire, without running water or electricity, and surviving on humanitarian aid. Children, and among them my friends, were dying every day, stuck by mortars. I experienced separation, forced internal displacement, loss of home, and the world as I knew it, the colorful, predictable, and safe space that ceased to exist. But when I think about these years, I also remember beautiful and long-lasting friendships that started in dark and moldy basements, unbreakable connection among neighbors, and habit to share the last piece of bread or firewood. I remember first love, sound of a guitar, and cold fingers holding a pen that is documenting all of that in the journal. I remember school, first in the basement and then in an actual school building, half damaged and windowless, frequently targeted by mortars during classes. Yet, we were doing homework diligently, were making school signs, organized dancing competitions, and went to chess tournaments. Thanks to our brave and devoted teachers, we didn't miss anything in our curriculum, nor our social and emotional development, and we had compassionate pillars of safety to lean on. Scholar Teresa Betancourt has published several articles on the importance of protective factors such as positive relationships with caregivers and community members. She emphasized school as crucial to provide structure, distraction, milieu for socialization, and hope for future. In 2015, I joined my friend and colleague Yasminko Halilovic in initiative to found War Childhood Museum with goal to tell the story of war through children's eyes. During the project, we interviewed tens of participants, now adult professionals, about their experience of growing up in war. We collected objects of significance with corresponding narratives and filmed video testimonies using method of oral history. In tens of interviews, even children that had gone through unspeakable horrors were narrating about play, improvised toys, comic books, mischiefs, and time spent with peers. They were able to recall loving teachers, UN soldiers sharing chocolate bars, and imaginative narrations by adults in the basement. Life was taken from them numerous times during 4 years of siege, but they reinvented it again and again and again. And then one day it was said that the war was over. Although excited to be able to take an actual shower, watch TV, eat candies, or play without life danger, The adjustment to normal life was difficult, both for those who stayed and those returning from abroad. Again, it was the school that was the most helpful with support of international donors. For example, in my high school, we were given a classroom to decorate it into a club, and foreign organization donated the music studio, meals, and stationery. Another organization renovated the house for classes of acting, design, fine arts, and English. Sport clubs opened their doors for trainings. Parks again grew flowers instead of gravestones. City was slowly but steadily being rebuilt, emerging into a new, larger, shinier one, providing opportunities for growth and development. And we started growing up, although we still divide time to before and after the war, and occasionally talk about experiences of siege. Most of us are fully functioning adults with agency, careers, families, and dreams, ready to take life responsibilities just like our peers worldwide. Thank you very much, and you are in my heart.
Thank you, Selma, for sharing that experience. It is 9:17, and I want to make sure that we have time. There's tons more that we can share with you, and I know that Susanna had another exercise for you guys that brought everything together. But we do want to make sure that we address some of your questions. So we're going to, Jasha, move on to that section now.
Так, я буду ставити питання українською мовою, бо вони надходять українською мовою, і попрошу наших перекладачів допомогти мені перекласти їх. Але почну з подяки до Селми, бо надійшло одразу багато теплих слів до того досвіду за те, що ви ним так зараз відверто поділилися. І був один коментар, який дуже мене сильно вразив. І зараз я так трохи починаю плакати, бо, власне, Селмо, дякую за те, що показали, що життя після війни, бачите, що воно може надихати, і що є рух, є на що спиратися, навіть коли війна завершиться. Вибачте, одну секунду. Це писали і учасники в чаті, я зараз почала це озвучувати, і дуже важко було утриматися. Вибачте, будь ласка. А до питань я буду ставити питання по черзі їх надходження в чат, і, друзі, експерти, попрошу вас визначитися, хто може на них відповідати. Одне з таких найчастіших питань в різних формулюваннях звучало так: взагалі, які первинні ознаки допоможуть зрозуміти, що в дитини є травма, і в яких випадках дорослому треба, знаєте, як бити дзвіночок і з дитиною звертатися до спеціалісту. І тут, власне, було ще і про баланс між, знаєте, над турботою, над занадто сильною турботою, опікою і нашими страхами дорослим, і тими ознаками, випадками, коли дійсно треба звертатися до спеціалістів і починати працювати з складним таким станом дитини.
Well, I will start by saying that a change in function is something that you always want to keep an eye on. And if there is an anxiety, if there is a fear, if there is a worry that's not affecting them, or is not affecting their relationships, or is not affecting their work or their schooling, then it's probably something that you can manage. But you really need to seek professional help if the function in any of those areas is altered. So if the relationships change because they're fighting more, if the personal well-being changes because they're not sleeping or not eating well, if they are in distress, those are the times when to seek expert advice.
I would also add that we're looking at the frequency of how often those things that Dr. Kirian mentioned are happening. So it's very common for kids to have reactions to this amount of stress. So for example, if they're having, 2-3 nights where sleep may be bad, or they're having nightmares, that's not necessarily cause for concern. However, if we're seeing persistent impairment in functioning where there's a week or longer that these problems are continuing, that would be a sign that it's probably time to seek the help of a professional.
Дякую. Я тоді перейду до наступного питання. Можливо, у вас є поради або спостереження, що робити, коли дитина відмовляється виконувати вправи? Це питання надійшло від одного з вчителів, який мав досвід впровадження запропонованих Pure Edge вправ. Був випадок, коли всі діти в класі виконували, а одна дитина стала в опозицію і відмовилася робити дурні, як вона висловилася вправи, які ніколи їй не допомагають. Як можна ось налагодити такий місток довіри між тією дитиною, яка негативно ставиться до таких вправ? І тут є уточнення, що в неї був до того травматичний якраз досвід, бо вона зі східного регіону України.
Elite, do you want to address that one?
Sure. So first of all, you always want to make it optional and let the child be in control of whether or not they are practicing these skills. So it might be that this child in the beginning is just an observer, and that's okay. And they watch all their classmates as they're doing it. And maybe something is still seeping in, and eventually they'll join in. Another thing that you might try out is letting the kids pick. Having a menu of some of these skills, and each day maybe a different child gets to pick, like, what are we practicing today? And that might give the child the agency of not being put on the spot of I'm being forced to, but I'm given a choice and I have the option. And I don't know, Victor, if there's anything else you want to add.
No, that's right. I just want to add that sometimes oppositionality can be an example of anxiety. So what happens is that if you say black and I say white, if you say white and I say black, we engage in this give and take. And that means that you're there with me. So if I say I don't want to do it, I'm expecting that you're going to try to make me do it. And that builds a relationship. So it might be that that one particular kid needs tools more than any other. But in our experience, tools developed by kids themselves work way better than what we teach them. So the toolbox is a very personalized item. So we teach them a lot of things, but they choose what they put on their toolbox. And they are also invited to put in their toolbox whatever they want, listening to music, drinking a glass of milk. I mean, it really doesn't matter what it is. They can put it in their toolbox. But like Dr. Petter said, giving them agency.
Дякую. Наступне питання таке. Чи є правдивим науково теза про те, що діти і молодшого шкільного віку, і середнього, і старшого від природи є доволі стійкими до стресу, і що, власне, можна цю ситуацію війни дозволити їм вирішувати самотужки, адже в Україні наразі доволі поширена в різних поширена в інфопросторі інформація про те, що не треба лізти до дітей з такими практиками і не треба намагатися залізти в їхній внутрішній світ, адже, наприклад, досвід Другої світової війни на теренах нашої країни показує, що із цим травматичним досвідом впоралися діти 40-х років минулого століття. Чи є це коректно з наукової точки зору?
No, I actually would say the opposite. I would say that there's nothing in the scientific literature that said that children are resilient by virtue of being children. In fact, the scientific literature shows the opposite. They're more vulnerable. If you take a population and expose children and adults to the same trauma, children will develop higher post-traumatic symptoms than adults. And the reason for that is that they are more vulnerable. They are developing. Their brain hasn't fully developed. Their physiology hasn't fully developed. That's why we take care of them. So children have the opportunity to build resilience, but only if we teach them how to do it.
Дякую дуже. Питання тепер так, від дітей перейдемо до дорослих, бо було кілька схожих питань, я їх згрупую так. Чи взагалі можна натренувати стійкість у дорослому віці? І що може робити доросла людина, аби цю звичку, навичку стійкості в собі вибудовувати?
So I will let the others opine on this, but let me very quickly share the good news that neuroplasticity that I talked about, every time we examine it, it gets later and later. We used to think that it was the late teens, then we thought that it was the early 20s, that the neuroplasticity ended at that time. Now we're thinking late 20s, and some articles really suggest that throughout life, our brain is very plastic. So there's always the opportunity to develop resilience when practiced and to develop adaptation. Anybody else wants to comment on that?
Yes, it is definitely possible to increase resilience, right? And all of us have, it's not something you're born with and you either have it or you don't. It is something that can be learned and can be enhanced. And some things to focus on is, one, we talked about that support system. And that's especially important for adults because a lot of times we focus on the children and forget to take care of ourselves, right? So finding individuals that you can talk with, expressing what you're going through as well, right? We encourage the children to talk. We should be doing the same. Talking about the difficulties that you're having or the concerns, that's one area, the social support. Another is finding meaning in your day-to-day, whether that's through your job or whether that's through hobbies or certain interests that you take up, but having a sense of purpose that you're doing something or giving or contributing can really be helpful in the aspect of resilience. And one thing that we really focus on in the profession of mental health is a term called compassion satisfaction. Why are we doing the work that we're doing? And by focusing on that, it can take away on focusing on a lot of the negativity, right? Because we're hearing a lot of difficult stories and we're exposed to that. But if we can anchor ourselves in the why are we doing, and you know, all the work that you're doing is so significant and helping these children, that can be really protective in terms of resilience. The third thing that we sometimes could forget, and this seems really kind of like simple, that we should all be doing it, but oftentimes in times of stress, this gets thrown out of the window, is finding things that we enjoy doing and purposefully scheduling them. Just like we schedule in, I have to go to work, I have to take my children to school, I have to cook dinner, but a lot of times we forget I have to find ways to have fun and to nurture myself and re-energize, right? And Susanna introduced brain breaks. You can definitely be applying those throughout the day for yourself, but also just leisurely activities, right? Thinking about and making a list of what are the things that I enjoy and what's going to be my coping plan, whether it's I'm going to take a walk for 1 hour each day or do some exercise. I'm going to listen to some music or take a nice bath. Right? It can really be anything and it's individualized, but finding the time to do it.
And I would also like to
Дякую вам дуже.
emphasize
І тут-
just that I would like to emphasize the importance of crafts as a coping strategy. Either it is knitting, sewing, or arts, painting, doing something with your hands, wood carving. You can do it anywhere. You can do it in basement. You can do it at home. It's very tactile, very repetitive, and it's also very helpful to lower anxiety and stress.
Одразу логічно вкладається питання, яке насправді було десь години тому, але як цікаво, сьогодні це все в нас вибудовується в один ланцюжок. І питання було таким: я займаюся медитацією, займаюся повсякденними рутинами, творчістю, але є відчуття, що я лише оманюю свою свідомість, а не дійсно допомагаю собі впоратися з тим, що навколо мене відбувається. Чи може бути таке?
You are really helping yourself. And it's important to remember that none of these are magical fixes, right? Especially with the level of stress that all of you are experiencing right now. It's not reasonable to expect, like, I'll do the breathing exercise that Susanna showed, or I'll do a craft, or I'll do something and it will totally make me feel better. And so it's very normal that sometimes you can be engaging in these activities and it feels a little bit like, why don't I feel better? And that's okay. But just by virtue of getting into the habit of doing these preventative things, it can be helpful for you in the long term, because we think about it like a pot of boiling water, right? That if you put a pot full of water and you just leave it on the stove and forget about it, and it's boiling, eventually the water is going to overflow and go all over the place. You need to take the lid off every so often, right? And that's the same thing that you're doing by practicing some of these activities, regardless of if in the moment they're not necessarily making you feel like you're doing something.
I like to think about it like learning how to play an instrument. So, you know, imagine that if you don't play guitar, imagine if I gave you a guitar right now and I ask you to play me a song, you probably cannot do that. But if you start practicing every day and learning every day how to do it, and maybe a year from now, you'll be able to play a song. And so the importance of practice is important.
Дякую. І завершальне питання. Я точно потім ще звернуся до Елізабет з проханням поділитися всіми покликаннями тощо, але таке, знаєте, напіворганізаційне. Чи плануєте ви або вже маєте можливість навчати тих спеціалістів з України, які хочуть долучитися, але які, на жаль, не знають української мови? Ну і, власне, питання, чи є якась опція долучитися до вас і навчатися українською мовою? Можливо, є якісь курси в передзаписі, які можна хоча б з субтитрами опанувати?
I'm going to let Susanna and Selma answer that question, because I know they've been in contact with some clinicians in Ukraine, and that online course that Dr. Petter mentioned, it's hopefully at some point going to be translated as well. So where are we with that, Susanna and Selma?
Thank you, Dr. Karen. Yes, we are trying to find translators for the course, for the online course, also with the help of Pure Edge. We are just kind of trying to find, translator to do it. So we are on the way, on the process. Once we find them and we arrange the contract and all that, I mean, we hopefully have it. Selma, I don't know if you want to add something to that.
Yeah, just to ask everyone to be patient because this is a very slow process. It takes some time and we are hoping to have it as soon as we can. Yeah, just to emphasize that it's a longer process generally to translate the course.
We'll let you know as soon as we have it.
А я з боку освіторії і нашого порталу Освіторія Медіа обіцяю поділитися з усією українською вчительською спільнотою шкільних вчителів, шкільних психологів про те, що цей курс доступний, і кожен із вас, тих, хто зараз нас слухає в прямому ефірі, ті, хто буде дивитися на записі, могли долучитися і подивитися на дійсно найкращі світові практики, і ось цей найкращий світовий досвід принести в український освітній простір. На цьому ми будемо завершувати нашу подію. Я дуже хочу подякувати команді, яка сьогодні до нас долучилася. Ми познайомилися через такі, знаєте, контакти далекі з усього світу. Ми ніколи не бачилися з сьогоднішніми експертами вживу, але вони запропонували свою допомогу, поділилися безкоштовними матеріалами, які наразі доступні на нашій платформі О-університет в тілі курсу «Розумію». Всі українські вчителі можуть скористатися цими матеріалами безкоштовно і привнести в кожен клас української школи найкращі практики турботи про себе, турботи про своє ментальне здоров'я. І я дуже дякую вам за цей вебінар, бо мені здається, що такі щирі сльози і надія, і знання сьогодні були не тільки в мене, а й у всіх, хто сьогодні був із нами. Від усього серця, з Києва. Я вам дуже дякую за те, що ми сьогодні мали таку неймовірну подію.
Thank you for having us.
Дякую, друзі. Запис я викладу найближчим часом, ви можете з ним ознайомитися. Всіма корисними покликаннями поділюся, і всі ті ресурси, які сьогодні згадувала команда Pure Age, ви зможете також отримати. Я бажаю всім безпечного дня, безпечного вечора і сподіваюся, що одного разу ми з Віктором, Сюзанною, Хілі, Чим і Сельмою зможемо зустрітися в Києві і, можливо, провести якусь офлайн-зустріч для української спільноти. Моя така найбільша мрія. Дякую вам, друзі. До зустрічі. Всім безпечного дня.